Greetings and welcome to Narcissistic Borderline Couples, a psychoanalytic approach to marital conflict. This is the first segment of a series I will be writing or presenting on marital therapy, which is based on my first book, The Narcissistic Borderline Couple. This is a book I wrote back in the 80s when a psychoanalytic psychodynamic approach was actually unheard of. It was very, very rare. And it was very frustrating for me because when I started seeing couples, there was no systematic approach to the treatment of marital therapy. So this is one of the reasons why I wrote this book. I talk about the 4 phases of treatment that couples go through. I offer treatment suggestions, suggestions for the couple, and so on and so forth. And in the following segments, I will go into that in more detail. Let me just tell you a moment about, or take a moment to tell you how this work began. This presentation today is based on my first book, The Narcissistic Borderline Couple. This is where I describe what happens when a narcissist and a borderline get together in a marital bond, or should I say a bind. I refer to this as the dance that couples get into, how together these oppositional types seem to end up in painful, conflictual, ongoing relationships that are circular and destructive, like a dance, or shall we say a rondo. Oddly enough, my interest in these couples began, as strange as this may sound, in the Middle East, where I couldn't understand why groups and nations couldn't get along or live in peace. And even when peace was offered them, it was repudiated and it was denied. As a matter of fact, I know this may sound like a stretch for some of you, but in my work in psychohistory, I actually did a diagnosis of the Arab-Israeli conflict as being very similar to a narcissistic borderline relationship. Of course, not a real relationship, but a mythological one. I used to say to myself, why can't they just be simple, kiss and make up and make peace? As a matter of fact, when we first moved from Europe, we lived in New York in like a boarding house or apartments that were very close together. And I remember walking around in the apartments and one day hearing a couple screaming and yelling at each other. I was 8 years old. I knocked at the door and I said to them, why don't you two just kiss and make up and say you're sorry? They said to me, little girl, could you please go home and go back to your mother? Well, luckily this didn't end my career as a marital therapist. I kept persisting, but it did evoke my curiosity. So this is the first segment of the series, and later on in other segments, I will expand beyond narcissistic borderline couples to talk about other types of relational bonds. For example, what happens when a histrionic hooks up with an obsessive compulsive. Say somebody like Marilyn Monroe with a Woody Allen. It has always been a huge mystery to me how these couples find each other, like a fox to a rabbit. But actually, it's not so important how they find each other. What's more important is the glue that keeps them together. How one partner will project a negative feeling into the other, and then how the other one, like someone like a borderline, will identify or over-identify with that which is being projected. Within these oppositional types, the revelation is, oddly enough, that these couples, as much as they fight and they battle and they don't get along, they need each other to play out their own personal drama, rooted in old sentiments, early trauma, old hurts, embedded in their current relationship. In simplistic terms, it really means bringing in old baggage into the relationship. So together they stir up many unresolved issues as they coerce each other into playing certain roles. Let me just take a few moments to tell you a little bit about myself. My favorite subject. I'm Dr. Joan Lachkar. I practice in Sherman Oaks, California. I'm an affiliate member with the New Center for Psychoanalysis, where I'm also an instructor, but I'm also a psychohistorian. And for those of you who don't know what a psychohistorian is, it is a discipline that analyzes political and historical events from a psychoanalytic, psychodynamic perspective. For example, I have published and written several articles such as the psychological makeup of a suicide bomber, the psychopathology of terrorism, aggression and cruelty in cross-cultural couples. Now, I'm not saying that everybody is married to a terrorist, but certainly the kinds of cruelty and aggression that occurs at the global level has been enormously helpful to me in understanding how it occurs at the domestic level. Lastly, now this may sound very odd as well, I have been a classically trained ballet dancer. And I'm sharing this with you because I use the metaphor of the dance to explain the dance of the couple. How these oppositional types stay in painful, conflictual relationships that are ongoing and go round and round. And even when good advice is offered to them, guess what? It is repudiated, just like it did in that apartment house with that couple when I was 8 years old. Let me take a moment now to tell you what marital therapy is. Marital therapy is a drama, a play. It is a deep emotional experience that occurs between three people, the couple and the therapist. We're both get immersed in the relationship drama. I must say, not lost. The therapist must not get lost, but absolutely get immersed in the drama. If she gets lost or he gets lost, one loses the technical neutrality to maintain a certain amount of objectivity. Back in the 80s, when I first started treating couples, as I mentioned before, there was no systematic approach to the treatment of marital therapy. In fact, I was so desperate when I saw my first couple, I called my colleagues and said, what do I do? How would I treat couples other than using a cognitive or a behavioral approach or a kissy-feely approach that were going on in the 80s? She said, well, your guess is as good as mine. And that's when I started writing, and that's when I first got this first book published. And the last colleague said, you know what, Joan, just do your own thing. So I did. And that's what I'm sharing with you today. Let me now define a narcissistic borderline relationship. As I mentioned earlier, it is two types of believered individuals, or two arrested individuals, psychologically arrested, who stir up highly charged, unfulfilled feelings and emotions in the other. The narcissist, they each need each other. The narcissist needs the borderline to get in contact with his needy, split-off self, and the borderline needs a narcissist to get more in contact with their entitlement issues, because borderlines don't feel entitled, whereas the narcissist feels entitled to everything. The more he withholds, the more I complain. The more I nag, the more he withdraws. The more he withdraws, the more abandoned I feel. I feel all my issues are around abandonment, and they come out while I'm with him. I feel like a nothing, like I don't exist, whereas the borderline feels like an everything. I am as perfect as mother wants me to be. And they often feel very attacked by the narcissism, which is a huge narcissistic attack by the borderline, which is a very big narcissistic injury for the narcissist, because they always have to maintain the semblance of being perfect, the perfect child of God. Me? I'm the narcissist. I'm perfect. I have no needs. I am happy with my sailboat, my computer, my dog, my workouts. I don't need you, and I don't need this therapy. Each one acts out a part in the other, and that's why I call it a drama and a dance. Let me now describe the narcissist. And by the way, in my other segments, I describe 8 different kinds of narcissists and 8 different kinds of borderlines. But I didn't know what to do with all these narcissists and borderlines when I was writing these books, so I just threw them in a chapter, and I figured they could just battle it out with each other. The narcissist survives by feeling he or she is superior to others. They are dominated by omnipotent fantasies, a feeling of specialness. Now, how do you know you're in the presence of a narcissist? You know because all they do is talk about themselves. The borderline, unlike the narcissist, where the narcissist is always trying to prove a special sense of existence, that they're entitled to everything, the borderline feels like they're not existent not deserving of any needs. And you can imagine how the narcissist, how the borderline feels when the narcissist projects into the borderline, who already has a thwarted sense of self. For borderlines, it is the entitlement that runs in the opposite direction. They are like a narcissist, but they run on steroids. When the narcissist gets personally injured, they withdraw, isolate themselves. When the borderline gets traumatized or injured, they attack, they blame, they shame. The borderline could care less, unlike the narcissist, about fame and success, or how they look, or how they dress. Typically, they are known as codependent, one who exists solely for the existence of the other, whereas the narcissist is more concerned about proving a special sense of existence. I'd like to talk now about the dance and the bond and the drama. These are two individuals who confuse love with pain. It is pain that becomes highly eroticized. It offers a semblance of aliveness. Better to feel the pain than the deadness, or live in the black hole or the abyss. Together they repeat the same drama over and over again. And why is it these partners, even when we offer them our good advice, they repudiate it or reject it? Are they crazy? Are they masochistic? Not all of them. One of the things that's most heartening to these couples is to let them know that they're not necessarily crazy to be in these kinds of relationships, but moreover, that each one does stir up some undeveloped part of the self, and they have an opportunity and a chance to address that while they are in this kind of treatment. Pain stirs up an amalgam of many undeveloped mental needs, which each one seeks out desperately. As pain is linked to the love object, it also becomes highly eroticized. This is what I refer to as traumatic bonding. Anything is better than the emptiness. At least I know, I feel, and I am alive. Let me now give you an example of the dance. I want to stay married. Married? Why do we need to get married? But isn't living together enough? No, I want to get married. But it's as though we are already married because we're living together, but we are not married. Marriage is just a piece of paper. No, it's not just a piece of paper. I was married before and it's no different than now. Then why did you get divorced? Because I didn't want to stay married. But if it was just a piece of paper, then why did you get a divorce? If you don't stop badgering me, I'm going to pack up and leave. That's what you always do when we have this discussion. Well, I don't want to get married. Then, do you admit that it's more than just a piece of paper? As a therapist, I find my head spinning. My head is just turning around and round when I listen to this circular behavior. I remember one time saying to myself, gee, this couple needs to be in therapy. And then I realized I am the therapist. I would like to now just have a few closing words and invite you all in to the following segments, which I will be discussing in future presentations. Mainly I will expand beyond narcissistic borderline couples into 8 different kinds of narcissists, 8 different kinds of borderlines, and it also will focus on my newer book, Common Complaints That Bring Couples into Therapy. And the last segment will address aggression and cruelty in cross-cultural couples. Meanwhile, I hope to see you then. I can be reached at www.joanlachkarphd.com. That's my website. My office number is 310-413-9593, and email is jlachkar@aol.com. Thank you.